In Chapter 12, we'll be discussing head and spinal injuries. Head injuries can be very serious. They could be scalp wounds, skull fractures, brain injuries, and spinal injuries can also present in people that have a head injury. So we have to really be careful about how we treat them. With scalp wounds, you need to control the bleeding by pressing on the wound. Replace any skin flap to the original position and apply pressure. If the skull fracture is suspected, press on the edges of the wound to help control the bleeding. Apply a dry, sterile dressing. Keep head and shoulders elevated if no spinal injury is suspected. If a spinal injury is suspected, you don't want to move the patient. If bleeding continues, add dressings over the first dressing. Call 911 if the wound is extensive and if there's facial damage or signs of concussion. With the skull fracture, what you look for is pain, a deformity in the skull, bleeding from the ears or nose, leakage of cerebral spine fluid, discoloration around the eyes or ears. If pupils are not dilated the same way, one might be dilated and larger than the other. If there's a lot of bleeding from the scalp, or if there's a penetrating object. With the skull fracture, you want to apply sterile dressing over the wound with gentle pressure to control the bleeding and call 911. If there's a traumatic brain injury, this is usually can cause short and long-term problems. Mishandling a person could result in permanent damage or death. The brain can swell when it's injured, and swelling can interfere with the functioning of the brain. It can be caused by a foreign object that penetrates the skull, bony fragments from a skull fracture, or if the brain hits the inside of the skull. Deceleration injuries, a person's head hits a stationary object, and an acceleration injury is when a person has been hit by a moving object. Concussions can occur when the blow to the head changes the function of the brain. It can take several minutes, months, or longer to recover from it. Most people make a full recovery, but they can have something called post-concussion syndrome. Other traumatic brain injuries include a contusion, which is a direct blow to the head. Contre coup, blow to the head that causes a contusion at the site of impact and hits the brain to the opposite side of the head. A diffuse axonal is shaking or strong rotation of the head that causes a tearing injury and penetration. A bullet, knife, or other sharp object enters the brain. What you need to look out for is if there's personality changes, if the person looks dazed, if there's changes in their coordination or reaction time, if their responses are slowed, if they feel disoriented or they're not responsive. If they have a slurred speech, vomiting, headache, blurry vision, nausea, or sensitivity to noise and light. What you need to do is, if they're unresponsive, check for breathing. If a neck injury is suspected or if the person's unresponsive, do not move the head, neck, or spine. Call 911. If the person is wearing a helmet, do not remove the helmet unless you suspect an obstructed airway. If you cannot stabilize the spine, you must remove it to provide life-saving care of an airway. So if a traumatic brain injury occurs, you need to seek immediate medical care for drowsiness, one pupil larger than the other, seizures, confusion, restlessness, headaches that get worse or don't go away, repeated vomiting, and slurred speech. Following injury, the person should get plenty of sleep and rest, avoid visual and sensory stimuli, ease into normal activities slowly, avoid strenuous activities, avoid another blow to the head, and don't use aspirin or anti-inflammatories. Acetaminophen like Tylenol is a better choice. If it's required, if the headache lasts more than 1 or 2 days, then you might need some further care. If the nausea lasts more than 2 hours, then you might need further care. Or vomiting, confusion, vision changes, any kind of mobility or speech impairment, or if you notice any speech impediments, any type of seizures or convulsions. So that is the end of part 1. We're going to continue with part 2 and talk more of other injuries involving the spine.